are new non-invasive CIN treatments available soon? Imagine a future where treating precancerous cervical changes doesn't mean surgery or cutting into the tissue. That future is getting closer as researchers explore new ways to manage cervical intraepithelial neoplasia, or CIN, with less invasive options. Several promising treatments are currently in clinical trials or early use stages, aiming to offer safer, tissue-preserving alternatives to traditional surgical procedures like loop electrosurgical excision. One exciting development is non-invasive physical plasma treatment. This method uses electrosurgical argon plasma to target and treat early CIN lesions without needing anesthesia or removing tissue. It's designed to be flexible and easy to apply, with the goal of controlling disease while protecting cervical tissue. Early studies show it can effectively treat CIN-1 and CIN-2 lesions, and ongoing research is looking at its safety for future pregnancies, since traditional excisional treatments can increase risks of preterm birth. Another promising approach is topical immunotherapy with imiquimod. This medication boosts the immune response and has shown high rates of regression in CIN-2 lesions in clinical trials. Patients can apply it themselves at home, avoiding surgery and multiple office visits. It has minimal side effects and could be especially useful for women with CIN-2 and possibly CIN-3, providing a non-invasive alternative to more invasive procedures. Advances in immunotherapy are also focusing on vaccines and immune checkpoint inhibitors. These treatments aim to help the immune system clear HPV infections and abnormal cells. While they are more established for invasive cervical cancer, researchers are exploring their potential to treat CIN and prevent progression, especially as new vaccine technologies like DNA, RNA, and peptide-based vaccines develop. Photodynamic therapy is another innovative option. It involves using light-activated drugs that target abnormal cells, with some systems designed for low-grade CIN and others for high-grade lesions. These therapies are non-invasive and could be especially helpful in low-resource settings, reducing the need for surgical procedures. Other experimental treatments are also in the pipeline, such as gene therapies, nanomaterials, and agents that inhibit blood vessel growth in abnormal tissue. While these are still in early research phases, they show promise for future non-invasive options that could change how CIN is managed. Overall, the landscape of cervical intraepithelial neoplasia treatment is shifting toward less invasive methods. These new options aim to preserve cervical tissue, reduce complications, and improve women's comfort and reproductive health. While some treatments like imiquimod and physical plasma are already being tested or used in limited ways, broader availability will depend on further research confirming their safety and effectiveness over time. It's important for women to stay informed and consult healthcare professionals to choose the best approach for their individual needs. This progress supports ongoing efforts to prevent cervical cancer while protecting fertility and cervical health, making future treatments more patient-friendly and accessible.